Hello everyone, welcome back to my channel. This video is the continuation of the understanding and treating burns. So before watching this, please go and watch that video part 1. Okay. So in this video we are going to discuss about the management of the burns. So let's get started. So the first we are going to discuss about the medical management. In this there will be 3 phases will be there, that is emergent, intermediate and rehabilitative phase. Emergent means from the onset of injury to completion of fluid resuscitation. So in this first aid, it includes first aid, already we have discussed, then prevention of shock, respiratory distress, detection and treatment of injuries, wound assessment and initial care. These all will come. So more or less we have discussed everything like assessment of wound, everything, rule of 9. These all will come under this. Okay, then intermediate phase from the beginning of the fluids to near completion of wound closure. So in this we will going to discuss wound care and closure, prevention or treatment of complications including infection, nutritional support. Then rehabilitative phase, in this the patient wounds will be, means from the wound closure to return to individual's optimal level of physical and psychosocial adjustment. So in this prevention of scars and contractures will come, then physical, occupational and vocational rehabilitation, functional and cosmetic reconstruction and psychosocial counseling. So these all will come under this and we will learn or discuss one by one. But in emergent already we have discussed first aid. Okay, then detection and treatment of injury, wound assessment and initial care we have discussed. Here, now we are going to discuss the fluid replacement, that is to prevent, it will come under prevention of shock. So the emergent phase will begins with at the time of injury and ends with the restoration of capillary permeability. So this goal how we are going to achieve by administrating the fluids. So there are the methods where we can calculate the fluids in order to administer the patient. So there are number of acceptable formulas are there, but here we are discussing about the few formulas which are practically acceptable or applicable. Okay, the first one is the Parkland formula. Okay, in this they will use the ringer lactate solution in the form of like they will take 4 ml into kg body weight into 1% body surface area burned. Okay, so whatever the thing will, means the number will come, that will be divided into 50-50%. So the first 50% will be given in the first 8 hours and the second 50% of the solution will be given in the next 16 hours. Like over 24 hours they will use this solution. Okay, then the various colloids also used, not only RL, we can use any type of fluids. Here one practice question is given by using that formula. Please pause it and watch. And the next formula is AIIMS formula. In this we can take any crystalloids like NS, RL, dextrose. Okay, so the formula is 1 ml per kg divided by percentage how much burned BSA plus albumin at 1 ml per kg divided by burns percentage plus 2000 ml of 5% dextrose. So whatever the solution you will get, that has to be divided into 50-50% and the first 50% has to be used over first 8 hours and the remaining half over second 16 hours. And the next 24 hours, this is for 24 hours, the next 24 hours same formula has to be used, but you have to decrease from 1 ml to 0.5 ml. The same formula has to be applicable, and this is the AIIMS formula. So in the Brook formula, the first 24 hours we will use like 2 ml into, means 2 ml into body kg weight into percentage, how much percentage will come, that body surface area. Everything you have to multiply and whatever the solution you have to will get, that you have to give 24 hours, like 50-50% divided, and first 58 hours, second 16 hours. And next 24 hours albumin infusion 0.3 to 0.5 ml into kg into burns percentage. Okay, so whatever the solution you will get, that you have to give over 24 hours by dividing 50-50. First 58 hours and second 16 hours. So this is the formulas used for the fluid calculation. Now we will discuss about the intermediate phase. Okay, it begins after 48 to 72 hours. Okay, after regaining the capillary permeability. Okay, in this mainly we will focus on the wound care and the closures and prevention or treatment of complications which include the infection. Okay, so first we will remove that debridement, whatever the dead skin will be there, everything will be removed. After removing of the dead skin, we will take the skin care for preventing infection, by using the topical antimicrobials like silver nitrate solution, iodine. Okay, these all the sources we will use. Silver sulfodiazine, mephenide. These are the some of the antimicrobial ointments. About bandages, okay, for dressing, in the market you will get the lot of different types of sizes, dressings, bandages you will get, which are like antimicrobial soaks with silver nitrate or mephenide acid. Already the medicine will be present in that, like antimicrobial salves, that is silver sulfadiazine, besitrine, neomycin, nystatin, mupirocin. These are like powders. Okay, so it just you have to spray on that and you have to be cover the wound with the bandages. Like synthetic coverings will be there, like BioBrain, Transilite. Okay, so this all will provide the moisture barrier to the wound in order to for the fastest recovery of the wounds. The next dressings are biological dressings. These are also reduce the burns, wound pain, and these materials may be organic or synthetic in origin, but good wound adherence is key to function. Okay, so organic materials can include like a skin, autograft or allograft from donors, and they can use the skin graft from the other species. Mostly they will use like pig skin, fish skin. Okay, so human amnion also they can be used for this in the skin graft. Okay, this also will helps in the wound recovery. And these biological dressings will be done through surgical management. Okay, so the surgeries can be like skin grafts, microsurgery, free flap procedure, tissue expansion. In the skin graft only it will become like allograft, autograft or xenograft, depends upon the how much of the thickness of the skin is involved. So what the types, like which layers has to be taken, like epidermis, hypodermis, subcutaneous or with fat adipose tissue. Okay, that will divide like a split thickness or full thickness grafts. So this is the example for the tissue expansion, that is A and B, and the left side it is showing how to harvest the donor skin from the thigh region. And microsurgery is the if any part, for example fingers, which will be hang like structure, but it is little bit will be touched with the skin. Okay, that they will do like a microsurgery, anastomosing all the blood vessels, connective tissue. Okay, that is called microsurgery. Flap procedure means they will harvest this skin from the donor and they will replace on the burning site which the skin was burned. Nowadays there is available of a pressure garments. Okay, these are the garments which will prevent and control the formation of hypertrophic scars by applying the counter pressure to the wounded area. Because of this it will be reduce the effects of hypertrophic scarring, thereby reducing the scarring and deformities of the body. Now we will discuss about the third phase, that is rehabilitative phase. It should commence on means it starts from the day of the injury, and the goals of the burn patient rehabilitation is to limit or prevent the loss of motion, prevent or minimize the anatomic deformities, and prevent the loss of lean muscle mass and return the patient to work on the normal activity. Okay, so the program should be start early. Okay, and it will be taking care of avoid the prolonged periods of immobility. Any body part that is able to move freely should be moved frequently. Means that time you have to educate the patient about the range of motion exercises, and there should be a planned program of daily activity and rehabilitative care, and the plan should be reviewed daily as rehabilitative needs change. Means according to the change of the needs of the patient, the rehabilitative plan has to be changed. Now we will discuss about the nursing management, that is our role. Okay, the first one is the first you have to do the nursing assessment. In this, primary assessment and secondary assessment will be there, and the primary assessment is when the patient will admit in the hospital. So that time you have to assess airway, breathing, circulation, any disability is there or exposure or need for fluid resuscitation, and also assess severity of burns and conscious level. That is neurological assessment has to be done. Okay, then assess the everything, establish the cause, like consider non-accidental injury and associated injuries, everything. Then secondary assessment, you have to collect the history collection, lab investigation. Okay, wound care means this will be the assessment will be continuous assessing. Okay, when the patient was admitted in the hospital during the time, pain and anxiety, fluid resuscitation, this all has to be assessed. Next is nursing diagnosis. Based on the nursing assessment, we have to make a diagnosis. Okay, the probably a diagnosis which can made for the burns patient is, first is the ineffective airway clearance related to edema and effects of smoke inhalation as evidenced by abnormal breath sounds and dyspnea. So the persons who are burned on the face and neck, or those who have inhaled flame, steam or smoke, should be observed closely for the signs of laryngeal edema or airway obstruction. Okay, so if it is above the glottis, is very susceptible to obstruction because of exposure to heat. So for that purpose, what you have to do, you have to encourage the patient to cough. Okay, so that secretions whichever it is be there can be removed by suctioning. Okay, in the severe situations, you can remove the secretions by bronchial suctioning or to administer bronchodilators, mucolytic agents. In early management, you can go for the, if the patient is means based on the patient's condition, it may require endotracheal intubation and mechanical ventilation. So these nursing interventions can done for the ineffective airway clearance. And the second is impaired gas exchange related to carbon monoxide poisoning, smoke inhalation and upper airway obstruction as evidenced by cyanosis, abnormal atrial pH, etc. So for this purpose, what you have to do means, you have to assess the ABG gas analysis. Okay, to get the baseline data about the atrial saturation. Okay, then you can, to what you can do means, elevate the head and chest by 20 to 30 degrees, which can reduce the neck and chest wall edema. Okay, like this interventions you can done for the impaired gas exchange. Next is the deficient fluid volume related to increased capillary permeability and evaporate loss from the burn wounds as evidenced by the concentrated urine and decreased skin turgor, etc. For this, burn injuries will cause the tremendous fluid loss will be there through the wound, okay, as well as the burns wound also, so which will in the form of edema. So you have to immediately replace the fluids with the two large caliber peripheral IV catheters has to be started. Okay, and you can go for the test also, like electrolytes, which we can like to assess the hemoglobin, urea, electrolyte and grouping cross matchings, everything. And you have to replace the fluids and electrolytes is an essential as soon as that burn victims are admitted in the hospital. Okay, it has to be started within an hour after a severe burn to prevent the hypovolemic shock. Next is the hypothermia related to loss of skin microcirculation and open wounds. So as evidenced by the body temperature below normal range, cool, pale skin, etc. So first you have to assess all the things like size, color, depth of wound and noting the necrotic tissues, condition of the surrounding skin. Then what can cleanse the wounds and change dressing twice daily and use the antimicrobial solution and perform the debridements. Then apply topical bacteriostatic agents. Then dress wounds as appropriate using the conventional burns pads. Then assess the wound and graft sites. Evaluate the color of the grafted and donor site, and promote the healing of the donor sites by preventing the contamination of the donor sites that are clean wounds. Okay, like these are the interventions you can done for the hypothermia. And keep the patient warm, and humidifier has to be maintained in the room. Okay, there should not be any fans or coolers like that. Next is the acute pain related to tissue and nerve injury. Goal is to control the pain. So here what are the nursing interventions can plan for it means for the patient. It is you have to assess the pain intensity, location, character, okay, with the help of a 0 to 10 scale, and teach the patient about relaxation techniques such as imagery, breathing exercise, progressive muscle relaxation. Okay, then maintain comfortable environment temperature, provide heat by providing the heat lamps and heat retaining body coverings, and administer anti-anxiety and antipruritic agents as indicated by the doctors, and provide emotional support and reassurance which is essential to reduce the fear and anxiety which results from the burns injury, and administer analgesics before wound care or before particularly painful treatments. Okay, so administer analgesics orally when you are doing the procedures before 30 to 45 minutes. Like this you can relieve the pain. And the next is the anxiety related to fear and emotional impact of burn injury. For this, goal is to minimize our patients and families' anxiety. Okay, for this you have to assess the patient's coping abilities, then individualize response to the patients and family coping level, then explain all the procedures to the patient and family in clear and simple languages in order to decrease the fear or anxiety in the patient and the family members, and explain the burns patient coping patterns to family. Provide opportunities for the patient to express thoughts, feelings, fears and anxiety regarding injury, and give frequent explanation and information about the care procedures. Involve entire burn team in care from admission to discharge, including social workers and psychiatric resources. So these are all the interventions for the anxiety. Addition to this, you can go for that infection and the nutrition also. For the nutrition and the impaired nutrition less than body requirements, for that you can weigh the patient's body with the dressing removed, maintain strict calorie counts, encourage the patient to view diet. Here mostly they will go for the nasogastric tube feedings. Okay, the provider diet with high in calories. And the risk for infection, you have to take care like aseptic techniques, hand washing, assess the wound daily, and use the antibiotics and antimicrobial agents on the wound. Okay, then monitor this WBCs and immunological status of the patient. Okay, these are all things you can take for the risk for infection. And these are the list of the complications of burns. Okay, that is infection, low blood volume, low body temperature, etc. With this we come